Welcome to the Dr. Mom Show. This is Dr. D, mom of three. Hope everybody's doing okay and you're having a great week. Today I'm very excited because I'll be talking about ear infections. I know this is something that is a very important topic to parents because it occurs very often and this diagnosis is made quite frequently in a practice such as pediatrics or family medicine. Of course, again, I want to remind you to subscribe to our channel and of course like us on Facebook. Don't forget to share our videos and always make sure if you want me to discuss any specific topics, just leave any comments of any topics you would like me to talk about. Again, the Dr. Mom Show is a resource. It's a way for me to provide some evidence-based medical information. However, it does not replace the child's physician or the patient's physician. So at the end of the day, you need to keep your appointments and your children's appointments because it is very important to speak to your physician and your child's physician. So as far as ear infections go, again, as I mentioned, they're one of the most common diagnoses that we make. What I would really like to talk about today is what we call acute otitis media, also known as an ear infection. There's different types of ear infections, but that's the one that I will focus on. So there's also something called a middle ear effusion, and the big thing you want to understand is that a middle ear effusion means that there's fluid there, however, there's not necessarily an infection. When you have an acute otitis media though, that's when there's fluid there and there's an infection that's happening. So pretty much that fluid is infected. So just because somebody looks in a patient's ears and says they see fluid, please note that there does not necessarily need to be antibiotics used to treat that fluid because other things can cause that fluid, such as upper respiratory tract infection or even allergies. However, if there is inflammation and redness, and a huge hallmark for an acute otitis media or ear infection is the bulging of what we call the tympanic membrane. So that membrane that we see when we look in the ear. So as you know, when we examine the ear, pretty much we're using that little light looking in there. You're probably like, oh my goodness, what are they looking at? But pretty much we're looking at that tympanic membrane, and we can tell a lot when we look in there. We look at what we call landmarks. So there's areas that we look to make sure that they're where they should be and they look how they should look. So for example, when we look in there, if we see fluid and we see that it's red and what we call bulging, we know that most likely that patient has an ear infection. Of course, some other signs that we can see is if the eardrum is perforated. Sometimes that will happen if an ear infection goes on for a prolonged time and isn't treated appropriately. Also, sometimes when we look in there, you may see that we may squeeze a little tube, almost like a mini blood pressure cuff. When we squeeze up the air of a blood pressure cuff, there's a baby one that connects to that earpiece or that scope that we look at into the ear. And what we're doing is we're getting ear to that tympanic membrane. When an eardrum or that tympanic membrane isn't infected, usually that membrane will be mobile. However, when it's infected, it won't be mobile. So again, these are just some things we look at when we're looking in the ear. Just to remind you, as far as risk factors for ear infections, some big things include patients who are the ages of 6 months to 18 months. That's probably when we see the highest incidence. Again, we usually see an increase in this incidence around 5 years to 6 years, just because that's when patients normally will start school. And of course, because they're around other kids, wherever there are multiple kids, there's always germs that are present. And other risk factors include babies who aren't breastfed or don't receive as much breast milk. It has been shown through research that breast milk does increase the immune system or strengthen the immune system of babies. This decreases the incidence of allergies, asthma, eczema, and ear infection. So whether your baby's breastfed or at least if you've pumped and given your baby milk with a bottle, that always helps. Another risk factor includes daycare, as I mentioned before, where multiple kids are, tons of germs prosper, and because bacteria just gets handed off again and again, there is a higher risk of infection. And then finally, smoke exposure. So secondhand smoking can increase the risk of ear infections. I know a lot of parents or families will say, I don't smoke around the baby, and I change my clothes or wear a jacket. However, unfortunately, this doesn't count because smoke definitely stays on you. It stays on your fingers, it stays on your skin, your hair, again, your clothes, and even in the car. If you go into a smoker's car, a lot of time you can smell it. So it does stay on you. So please be diligent about that. In addition, some studies have shown that communities that have a higher amount of air pollution, so again, states that are busier, larger cities that have more industries that have air pollution, there would probably be a higher chance of ear infection in those areas. And finally, just to let you know, if your baby is tugging at their ear or their child is tugging at their ear, there are some other things that we think about. It may not necessarily be an ear infection. A lot of times it can be from trauma or from a foreign body. I've seen a Barbie shoe in somebody's ear before that I had to take out. Other things could be a sweet pea, little toys, beads. So please be mindful of things like that. Also, sometimes just a wax buildup can bother kids. And of course, if a patient has an upper respiratory infection, and teething is also something that can cause it because there's swelling in those gums, and a lot of times that pain will radiate into the ears, and kids will have a tendency to tug on their ears or sometimes kind of go like this to try and see if that will help the pain. However, there is radiation of pain from teething. But some telltale signs that you can look for, of course, is if there's any drainage, of course, if any fevers are associated with it, fussiness, decreased appetite, diarrhea, sometimes vomiting can be associated. So these are all things that you can look for. Well, I hope you will continue to join me in my series of ear infections. This is just part 1. Next time I'll talk about the bacteria that causes ear infections and how we treat ear infections. I definitely, again, am excited about this topic because it's something that I see very, very frequently. And of course, don't forget to wash your hands, kiss your kids, love your family, and say your prayers. And again, don't forget to subscribe to my channel and like me on Facebook. And of course, share these videos and keep track because the Tripsies will continue to make their appearance. I hope you're enjoying their clips. And thank you again for joining me. Have a great week. Bye-bye.